And joining us now is Dr. Mark Horne, Chief Medical Officer, South Central Regional Medical Center, past president of the Mississippi State Medical Association. Good morning, Dr. Horne. Good to see you again, sir. Thanks for coming on.
Thank you so much.
Yes, sir. So, somewhat active legislative session vis-a-vis health care. We got 3 or 4 measures that are notable. We'll start with the grant program that was established to provide some funding to struggling hospitals. $105 million, I think, was the total amount. That sounds kind of like a drop in the bucket, honestly, when you consider some of the losses being incurred by these healthcare institutions. We got tax credit program for nurses and advanced practice registered nurses. We got some student loan forgiveness programs to try to stimulate and attract more nurses into those programs. We need more nurses, obviously. There's a tremendous shortage
Absolutely.
of that. And then we got a bill that makes it a little easier for hospitals to consolidate. I didn't even know that was a problem, honestly, until that came up this session, and we got some legislation to kind of clear out that log jam. So I think that's a pretty good summary of the major measures. Did you feel like that this was productive, or did we need to do more?
It's a beginning. It's better to begin than to stand still, but it's nowhere near what's going to be necessary to really solve the problems of healthcare in the state of Mississippi. As regards the $105 million grant program, I was speaking to someone recently, and it's kind of like you're bleeding to death and you need major surgery. And what we got is a really good pressure bandage that's only going to last for a period, or Band-Aid, really. And it helps. Look, it's better than nothing. If you're dying of thirst, a swallow of water is good, but what you really need is a steady supply. And so it's a beginning. As regards the nursing, and there was another one about physician workforce. We're woefully inadequate on nursing and woefully inadequate on physicians. Anything we can do to grow, and we know that when you grow physicians in particular, and I believe the same thing for nurses, when you grow them locally, when you train them, and here, they have a greater tendency to stay here, particularly for physicians. They tend to stay where they finish their training, where they finish their terminal training. So if we train more physicians, residencies in the state, much more likely we'll keep them. The $105 million, my small hospital in Laurel, we're losing money every month. I've been here for 31 years. We've always, in 31 years, at the end of the year, we've always had a positive balance sheet. It might have been very small, but it was about positive balance sheet. And it's a real struggle to see right now how we're going to do that at the end of this year. Prices for employees are going up. We're not upset at our employees, but if we don't get paid more to do a service, and we're not, and in many cases we're getting paid less, and then when that happens and your cost of doing business goes up, you've got a problem. Business people know that, and then we are mandated. And again, I'm happy that we're thrilled. We see patients and we take care of people that are sick, and we're blessed to be able to do it. It's a wonderful profession. But when you're mandated to do it, whether the person receiving the services can pay or not, and then you don't have, and then on the paying patients, you're getting pressed from all sides. It's a problem. It's a challenge. And I don't think any other, if grocery stores were run that way, if gasoline stations were run that way, I doubt very much they'd be in the same problem, have the same problem, or be out of business.
Yes, so certainly reports are that many healthcare, hospitals in particular, institutions in the state are in the red, producing a negative cash flow. So, Dr. Horne, is this something that is discussed regularly in board meetings, let's say at your facility at South Central Regional Medical Center? Is this something the board talks about like every single meeting, right?
It is something the management team discusses and pays attention to and tries to remedy on a daily, hourly basis. Sure. And the boards discuss it all the time. And the same thing my friends around the state tell me. And it's not just small. So we like to talk about Greenwood, LaFleur, or very small hospitals. Forest General Hospital, public hospital, those reports, those financial reports are public record. Losing money. Memorial Gulfport, losing money. Baptist System, Baptist, over $1 billion a year in revenue, they're losing money.
Yep.
And there is a systemic problem here, and it's not the people running the institutions, it's the system. We have insurance companies with essentially monopoly power to dictate what they're going to do. We have a lack, I'll say it, we have a lack of expansion. Our state leaders have lit a match to $1 billion a year of federal money that could be used through Medicaid expansion. And it can be done in a way that's very conservative and consistent with conservative principles and provides care for our patients and improves the workforce strength in our state to attract businesses. We've lit a match to it. Over $10 billion thus far, and another $1 billion this year because they just haven't seen clear to and conservative states all around us have taken advantage of this.
So speaking of Medicaid, you're well aware that the continuous enrollment provision of the very first COVID aid legislation that passed in 2020, that continuous enrollment provision just ended effective April 1, which means that the states are compelled by the federal government to begin reviewing their rolls for those who were no longer eligible for Medicaid coverage, and they have to be removed from the rolls. It's estimated that could affect some 120,000 Mississippians enrolled in Medicaid. What are you think about that? Are you concerned with this?
We're very concerned. I mean, this is one of those things that I don't think our state Medicaid had a choice in the matter. They didn't have a choice when this situation was set up, and they don't have a choice now except to do it. They have their own record in their document in which they lay out what they're going to do, say, hey, this is the greatest challenge we faced in the last decade. And so it's a real bureaucratic challenge, a challenge of paperwork, how to get it done. The fear as a physician, someone who takes care of these patients, the fear that I have is I've got a lot of patients on Medicaid who don't necessarily have secure internet. Maybe they don't have secure phone services. They may be changing addresses because of needing to rent at a different place or being evicted or whatever. They may not know that they need to be enrolled. They may not be getting the mail that says they need to be enrolled. They may not have the sophistication to know what to do. They're confused. And so then they end up off of Medicaid. And so, yes, we understand there's really important to have people who don't need to be on Medicaid, who've gotten a great job and now don't need it, to be sure that those people get off services. But in the doing of that, we need to be absolutely certain that we protect those most vulnerable. And that's my greatest concern.
Yeah. Yeah, so it's going to be quite the tall order. I was not aware that Medicaid said, this may be the largest task, the most difficult task we've ever had to deal with. But it makes sense because the rolls blew up and the federal government says, and you can't disenroll anybody. And all of a sudden now they're saying, now you got to go disenroll everybody that is not eligible. Plus, at the same time, of course, the federal government is paring back the reimbursement. That phases out that enhancement through September. So you got to deal with that as well. Less money coming from the federal government, and they got to get folks off the rolls to make ends meet.
The Mississippi Medicaid's operational unwinding plan, which was available, I think it's available online. I've got a copy I'm glancing at right now. That's where that comes from. It's in the first 3 or 4 pages where they outline it. So that's not something I made up.
Yeah, no, and certainly wasn't suggesting you were, sir. But
I didn't think you were. But listeners might say, "Oh, that's hyperbole. That's just some hospital executive or physician." And guys, this is another of those episodes where people in the public, and particularly our leaders, don't seem to understand the severity of the situation we're facing.
Yeah, it just didn't get a lot of attention. There's more attention on blocking Medicaid expansion. There was a fair amount of attention on postpartum extension. But this disenrolling of those that are covered by Medicaid we started talking about that on this program months ago, and it just didn't seem to get much attention. Now it's here, and we're just going to sit back and watch as it unfolds. But I think the legislature is going to end up probably having to take some sort of action to deal with this. But, Dr. Horne, we really appreciate you calling in this morning and giving us an update there, and I'm sure we'll be talking to you soon. Thanks a lot.
Anytime. Thank you.
Yes, sir. Dr. Mark Horne, Chief Medical Officer at South Central Regional Medical Center, past president of the Mississippi State Medical Association, has been our guest. We're coming right